Yes, I'm going to talk about the immunology response. And first of all, I would like to give you the whole overview scope of the COVID-19. For this iceberg, you can see the uh, the population, they are under the water without without any symptoms, and the some proportion of the clinical manifestation are above the water, and among them, 20% uh, are asymptomatic cases, and 60% are the mild to moderate conditions, and 20% are severe cases. And when they treated in the hospital, or they uh, maybe in the observational um, healthcare unit, and they will go into maybe discharge or recover from the hospital, or some of the majority of them may be home quarantine or still hospitalization, but maybe very small percent of them they go into diseased. Yeah, this is the whole scope of the COVID-19 disease. Um, Regarding to the antiviral immune response, when our respiratory tract exposed to SARS-CoV-2, and the first thing is the virus will damage our epithelium, and then uh, our immune cells will come attack the virus, and this immunology cell, including NK T cell, dendritic cell, and other type of lymphocyte, especially T lymphocyte. You can see the T subset, including CD4, CD8, and Th17, and also they produce substantially a large amount of the cytokine, which means if it is in extremely heavy, they will uh, end up with cytokine storm. And the B cell will secrete the antibody in terms of the IgM, IgG, and IgA, and all these cytokines and antibody will fight against the virus infection and try to get rid of the virus. Um, in a very severe situation that including the virus per se, because if the load of the virus is kind of large amount, and it had showed that a high level of viral replication, and also on the other side, our defense system worked so hard, and even worked overwhelmingly hard, that bring about the situation of the cytokine storm, uh, and ARDS with the high acute phase of reactant, and the lymphopenia and eosinopenia, and also other uh, uh, situation of the immune response. So in this case, maybe the patient will get a longer time to recover, or even they maybe uh, fail to recover from the disease. And we have discussed a lot of the manifestation of the disease, and also uh, it it is very matter that our balance of immune response will play a very important role for the recovery or the progression of the disease. If the uh, the immune response go to abnormal or turbulent, maybe the disease will uh, uh, develop severe and also the fatality. But all the immune parameters measure upon the admission of the hospital, but little is known about how different of these immune parameter in the dynamic uh, style and their relationship with the progression of the outcome of COVID-19. So we have this study to address the dynamic change of hematology and immunology biomarkers and their association with the severity and outcome of the disease. We have around 548 cases, and among them, majority of the patients are mild to moderate stage, and uh, 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 155 patients are severe cases, and small amount of them, 48 cases, were critical cases. And then we measure the, uh, the clinical symptoms and immune parameters during this uh, duration of the hospitalization. You can see uh, there are still a little amount of the patient with mild moderate situation. They're going to die. They even they are light of the disease, they will die because of maybe the suddenly increase the immune response. And we can see the patient with critical ill uh, stage, and still have some of the amount of them they survive. So it is about the virus load and also our response of the immunity will play this important role in the progression of the situation. And then you can see when you compare the hematology parameters between survivors and non-survivors, you can see the lymphocytes, leukocytes, and neutrophils are uh, significantly elevated in non-severe when you compare with those in severe survivor. But the lymphocytes and the eosinophils were significantly lower in non-survivor, and also the uh, 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 platelets also decrease in non-survivors. And also you can see the NLR and PRR also increase significantly in non-survivors. And looking at the T cell subset, when you compare those T cell subset between survivors and non-survivors, you can see significant decrease in CD4 positive, CD8 positive, and other type of lymphocytes in non-survivor group, and which means the whole um, uh, amount of lymphocyte decreased significantly in the very serious and diseased patient. So the lymphocyte maybe is a very key parameters to looking at for the progression. And regarding to the indexes related to infection, you can see SAA, CRP, and ferritin and D-dimer increase significantly in non-survivor, and also the cytokine, for instance, IL-6, also increased significantly in the non-survivors. And the beauty of this study is we study the kinetic or dynamic change of those hematology and immunologic indexes during the hospitalization. We found patterns. Pattern one is uh, uh, regarding to the amount of eosinophils, lymphocytes, and platelets. We can see a significantly continuous upward chain in survivors, but a downward chain or keeping low for the level of those cells in the non-survivors. And also, we can see the pattern 3, a kind of no clearly accrual of this pattern, including the basophil and platelets to lymphocyte ratio. But pattern 2, you can see a majority of these parameters maintain at significantly lower level or show a significantly downward trend in survivor, but upward trend or maintain at high levels in non-survivors. And we perform some cell-to-cell and index interaction network on admission and at the end of the hospitalization. In all of our patients, we find the interaction among hematology and immunology cells in both survivors and non-survivors on admission, um, showing a very strong interaction among the cells. Um, as this indicated immunologic profile associated with host antiviral defense, but in very different status between the non-survivors and survivors. And compare with the subsiding of the cell-to-cell interaction in survivors, we can see still there are some strong interaction between the cells and the parameters in the non-survivors, suggest higher viral load plus inflammatory turbulence might contribute to mortality of the COVID-19. And we performed the principal component analysis for immunology, cells, and biomarker. We found top 3 positive contribute indexes on admission, including lymphocytes, CD4 T cells, and CD8 T cells. And at the end of the hospitalization, including platelets and lymphocytes and eosinophils. They are the positive contribution for the critical situation or non-survivors. But there are negative contributed indexes at the end of the hospital, like CRP, ferritin, and SAA. So the principal components really tells us about the risk and protective parameters in contribution of the progression. And also we perform the multivariate cost proportional by the hazard regression model, and we can see the risk factor are age very old, older than 16 years of age, and increasing in the numbers of neutrophils, and also decreasing the number of eosinophils, and also increasing in the number of the basophil, and also others. And we can see the increasing in the levels of the IL-6 also was the risk factor for the fatal situation. And also we can see the increasing in the numbers of lymphocytes and eosinophils, and also the platelets, were the protective factor for the patient not having the critical situation. Uh, Therefore, we're looking at some literature. Uh, we found our colleagues in Hong Kong, Gary Wong in Hong Kong Chinese University published a paper regarding to the SARS-CoV-2 infection in children. They came about the data regarding to the epidemiological characteristics and clinical feature of the infected children actually are limited, is similar in the findings in the United States, and only very less proportion of them are involved in children. And they analyzed some of the cases, altogether 1,300 something, and they have some clinical data. And also you can see the turbulence of these hematology parameters and infection biomarkers and also others. You can see the percentage of this abnormality show that very small amount of our children have the abnormality of these parameters. But if they show abnormality, maybe the degree or the symptoms may be very severe situation. And one of our colleagues in Shanghai just published one study looking at the role of the peripheral blood eosinophil count in COVID-19 patient. You can see here that the reduced eosinophil in the severe cases and the increase in the eosinophil count in the mild cases. And also you can see the severe patients, they have a lower level of the peripheral blood eosinophil level, and the non-severe patient, they increase their eosinophil level. This study actually matched with our finding. Then it is very interesting that the function of the eosinophil in fighting with the virus infection. And one of our colleagues in Hangzhou, in Zhejiang University, Professor Hua Haoshen, just published their study, a very interesting study looking at the hemostatic and early recruited CD101 negative eosinophils suppress the endotoxin-induced acute lung injury. And this is a very beautiful graphic abstract. They show that if the patient they have a CD101 negative eosinophil, and this group of eosinophil, they have the if they have lower amount, they have the best situation of the exaggeration of the infection. But if they have increased amount of this group of eosinophil, actually they can inhibit the infection of the virus. But on the other hand, if the patients with allergy and they have the other phenotype of eosinophil, like CD101 positive eosinophil, and they actually promote the infection of the virus proliferation, and also promote the lung inflammation and injury. And these two distinct of the phenotype of eosinophil actually will have another thinking of the way we treat COVID-19 patient, or the dose of the steroid uh, of the use in this situation of the patients. Uh, Now we have the summary of all the study. Altered interaction among immunology and hematology indices indicate impaired immune response in COVID-19, and restored lymphocytes with eosinophils and platelets could predict recovery, and the progressive increase in neutrophils and cytokines were associated with mortality of COVID-19 patients. I would like to thank the contributor of all the doctors and researchers in the hospitals worldwide in China. Thank you very much for your attention.